Let's see what is the concept of Koshta in Ayurveda. Why Ayurveda doctors always ask you how is your bowel passing, how is your bowel motion, why is excretion that much important as per Ayurveda. That is related to Koshta Pariksha, assessment of your Koshta. So, in that, nature of your stools is assessed, and that is assessed to know what is your dosha predominance. You are having more vata predominance in your body, pitta predominance, or kapha predominance is assessed by that koshta parisha. And the word koshta can have two types of meanings in Ayurveda. First one is related to this, that is the general alimentary tract, whole alimentary tract from mouth to anus is considered as koshta. And several koshta angas, like several organs in the body, like amasya, pakvasya, this correlated to stomach, small intestine, large intestine, etc. The parts of the alimentary canal are also said to be koshtangas as per various acharyas. Whereas this koshta parisha is another unique concept in that the nature of the alimentary tract is assessed through knowing how the bowel movements takes place or nature of elimination of feces. Koshta is known as Mahasrodasa, the great channel, which is from mouth to the anus, that is complete digestive system, and as Abhyantara Rogamarga or the internal pathway of diseases. So let's see what are the types of Koshta. First one is Krura Koshta. In Krura Koshta, as the predominant dosha being Vata, increase of Vata produces hard feces with difficulty of elimination or even non-elimination. Koshta is dominated mainly by Ruksha and Khara qualities, that is, dryness and roughness of Vata dosha is predominant there. So, the person is unable to pass stools easily. He is having that dryness and roughness. That is why constipation is said to be increasing Vata in the body. So, we have to decrease the Vata by taking more snigdha, oily, unctuous things in food and lifestyle. So that is the basic principle there. The next one is Mrudu Koshta or soft bowel. Predominance or increase of pitta causes watery or semi-solid feces, moving out more than once or twice in a day. Mrudu Koshta is characterized by Sara, laxative, Drava, fluid property, Snigdha, unctuousness, and Laghu, lightness, guna of Pitta dosha. Hence, the Koshta will be smooth, lubricated, and slippery. Secretions will be more, but it will be poor in absorption. So, some people, when they consume milk, that time itself, maybe twice a day, they pass stools without any difficulty. Such people are having Mrudu Koshta. Third one is Madhyama Koshta or moderate bowel. Predominance or increase of kapha causes soft, solid fecus moving out smoothly. In Madhyama Koshta, there will be predominance of Snigdha Guru, heaviness, and Sthira, stable guna. Koshta will be secretive and will have more lubrication but less slippery due to Guru and Sthira guna of kapha. So, solid, well formed stool will be formed in such people. Madhyakoshta, which is due to the Samanavastha of three doshas, there will be optimum secretion and absorption. That is actually the fourth case in which all the three doshas are in balance. In such people, all these things takes place very smoothly. And this Koshta Parisha or assessment of Koshta, what is the clinical significance? Koshta is the expression of bowel habit which depends on Prakriti, constitution. So a person with constipation is having Krura Koshta. That is a general assessment. But we have to know more details by asking the patient also. Then clinical significance explain more. Examination of Koshta is necessary for Roga Nidanam, means to diagnose the disease. What is the cause of the disease? This is important. To find predominance of doshas and prakriti, as I said before, which dosha is predominant, that can be assessed by this koshta parisha. Mostly vada prakriti has krura koshta, pitta prakriti person has mrudu koshta, and kapha prakriti person has madhyama koshta. By knowing prakriti, roga nidana becomes easy. So the cause of the disease in such a person, it can be assessed very easily. Then roga chikitsartha means to treat the patient. Koshta Pariksha helps physician to judge line of treatment, that is Shamana as well as Shodhana Chikitsa. Shamana Chikitsa means just the lining up of the dearranged, which are out of arrangement. Such imbalanced doshas are just lined up equally by some medicines mostly. And when it aggravates, when the doshas aggravates, it becomes necessary to expel them out, the vitiated doshas, the so much increased doshas. That is the Shodhana Chikitsa. So that is the major Chikitsa in Ayurveda. The Panchakarma treatment is a kind of Shodhana therapy. Before Shodhana Karma, Snehapana is one of Purva Karma. Before doing proper Panchakarma treatment, there are two types of procedures. First one is Pura Karma, and the actual procedure of Panchakarma is called Pradhana Karma, and after care is called Paschat Karma. So in that Snehana Dravya, that means some oil or something which can lubricate the body, is given to the patient. Snehana Dravya and Sneha Matra in proper dosage, it can be decided by Koshta Varisha. So for example, if the patient is having Krura Koshta, Krura Koshta means he will be having more dryness, roughness in his body. So he will need more amount of oil or more amount of ghee to make his body that much oily to be suitable for the treatment. So he will have more dose of medicine. And in people having pitta or kapha predominance does not need that much of medicine. So the dosage also is decided according to the koshta, according to the prakriti of the patient.